In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold.
A SARS-like virus, which has infected hundreds in China, has now reached the United States. Airports around the world are stepping up health screenings on passengers arriving from Wuhan, China, the epicenter of the outbreak.
I have today declared that the coronavirus presents a public health emergency in the United States.
Washington reports the first coronavirus-related death in the country. They become the first state to issue a state of emergency. Several states follow as we enter the month of March.
A public health emergency.
A declaration of emergency.
State of emergency.
And by March 8th, confirmed U.S. coronavirus cases reach the 500 mark.
The second way you reduce the spread besides testing is reduce the density of people. We all talked about how it's contagious, touching surfaces, etc. Reduce the density. So we're going to take very dramatic actions in that regard.
Officially declaring a national emergency.
I'm here to inform you today that Oswego County has now joined other countless communities across our state, country, and world affected by community spread of COVID-19.
And we have to be aware and use our PPE appropriately and be cautious that we're not overusing.
We do have cases here in the city of Oswego. It should hit home. It should bring a new reality to the situation and make the public take it much more seriously than we were before.
Only essential businesses can have workers commuting to the job or on the job.
It is much better to seek early intervention than to wait until the problems and illnesses can become a tragedy.
You know, a few weeks ago, we were in a position where, because we had to cancel our elective procedures, Mark, what percentage of our employees would you say would we want to furlough?
Approximately 25%.
When a patient arrives to the emergency department, they will enter through these doors behind me, where they will be safely and effectively screened by nursing staff and healthcare professionals.
A new chapter on reopening, restarting the economy. This is all a situation that has never happened before, so this is a first case for all of us.
Hi, my name is Michael Hartlevick. I'm the president and CEO of Oswego Health. On behalf of the Oswego Health Administration, medical team, and staff, I would like to welcome back our community. The Oswego Hospital, Fulton and Central Square Medical Centers, urgent cares, primary care practices, and our other specialized service locations are open, safe, and ready to care for you.
Although elective surgeries are back, many hospitals still can't allow visitors. But Oswego Health won't just cut the cord. The staff came up with a system to keep families connected and at ease.
The dedicated staff at the Manor is using technology to allow residents and loved ones to interact. Even though it's virtual, Santiago says he's seen firsthand with an Alzheimer's resident at the Manor the importance of this interaction.
Well, there's a new spike in COVID-19 cases now discovered at a food processing facility in Oswego County. A reminder that the virus is still spreading.
And we're proud to say that Oswego Health was named the top 5% in the nation for patient safety 2 years in a row.
We are incredibly thankful to all of you serving and caring for those in need. We are proud to play a critical need in this fight by partnering with you and supporting you.
News has now confirmed the first batch of Pfizer vaccine has now made it to the U.S.
Oswego Hospital, 99%. Richmond University, 93%.
I'm very happy that the governor acknowledged us. I'm very proud of the staff that helped get this to the point that we've been able to use the vaccine we're given.
There are a lot of people out there in the world, Michael, that you read about that don't believe in this virus. And I really think they ought to come in and spend a day following this medical staff around, because they're working their tails off, you know, trying to help people like me and others.